Are you having pain in this part of your forearm, this part of your elbow? We're going to cover that in this video, a bunch of different techniques that you can use to improve that. Welcome back to Overhead Athletics. I'm Max Wardell, and we're going to cover different techniques that you can use for this lateral elbow here. So there's a lot of stuff going on often in this lateral elbow, and there's a bunch of different things we can actually do to improve that. So you see all this junk sitting on the table here. We're going to use a bunch of these different things, and if you don't have this stuff, I'm going to give you techniques that you can use as well. So we're going to go through ultrasound, stim. If you don't have that stuff, you probably have a nice roller there that you can use at home. You have your hands, you probably have some sort of light weight or something you can use like that. So we're going to go through a bunch of different techniques that you can target this lateral elbow with. And the same thing applies on the medial elbow with a few different caveats and a few different things we'll do on this medial elbow because there's other stuff going on. So in another video, we're actually going to cover this medial elbow. When there's a few different things we have to consider when we look at the lateral elbow versus when we look at the medial elbow. So that'll be another video. In this video, we're going to be talking about that lateral elbow and how you can use different massage techniques and movement. And the first thing I want to talk about when we look at this lateral elbow and you're having pain in here or maybe down into this area is, do you have a nerve issue? So sometimes we see pain down towards more of the middle of the forearm. We'll see more of a radial nerve issue where there's compression of the nerve. That's fairly rare. The likelihood that you have that is very, very low. What you probably have going on is either a tenosynovitis, a tendinosis, or a tendonitis. So to differentiate those a little bit, I'm going to show you a picture right here on the screen of a tendinosis and a tendonitis. A tendonitis is actually inflammation of that tendon. Now, a lot of people think that they have tendonitis when in fact they have a tendinosis, which is a degeneration of that tendon. Tendonitis has to do with inflammation, where when we have actually a tendinosis, there's no inflammation. And a tendonitis is going to go away pretty quickly unless you continue to exacerbate it or aggravate it. So this is something you might have for 2, 3, 4 weeks. I see this a lot of times in my young throwing athletes. But at times I'll see a tendinosis in a high school, college age kid who's constantly putting stress on that tendon, and that tendon is actually starting to get some micro damage, some tearing, and some degeneration. So basically, if you imagine that you have a bunch of fibers lined up in the tendon, and they should be parallel in a tendon, what happens with a tendinosis or a tendinopathy is you get water infiltration and splitting apart of those tendons. And so that's a bit more difficult to deal with, and if you've had a tendonitis for a long period of time, 3, 4, 6, 8 months, you're likely dealing with a tendinosis rather than a tendonitis. The other common one is a tenosynovitis, which is essentially the sheath. So the synovial sheath that surrounds the tendon can become inflamed as well. Similar to a tendonitis, it'll resolve quickly relative to the actual tendinosis. And so if you're watching this video and you've been dealing with pain for a long period of time, you're probably dealing more with that tendinosis where the actual tendon has some damage to it rather than just an inflammation. If it's something that goes away and maybe comes back another 6 months later, you may have some recurrent tendonitis, but we want to resolve those as quickly as possible. The longer those inflammatory cells and metabolites sit in the area, the worse for that tendon. So the first thing we want to do is improve blood flow to the area, but also induce some rest. So whatever's bothering it, we want to rest from that activity. We do want to improve blood flow to the area, and there's a lot of ways in which we can do that. So the blood is actually going to bring the nutrients. So you can actually do some light activity. So I'm just doing extensions of my wrist here, which is going to use these muscles. And sometimes in my throwers, I see more soreness in this area, which is actually one of the elbow flexors. So this muscle you see right here, brachioradialis. So I might do a little bit of light elbow flexion. I'm not doing anything that's bothering it. If I'm having pain, I need to stay out of that range of motion. I'm staying where I'm pain-free and where I can just start to activate those muscles. The other thing you can do if you're really sore is I can pull it up with my other hand and just let it slowly come down. So I'll pull up, slowly come down. So I'm doing what's called an eccentric or a negative. and I'm just trying to actually pull those fibers back together. Now, if I'm able to do that stuff, I can progress to a weight and do it, or I can do it like this. This is 3 pounds. This would probably be too much to initiate with. A nice half-filled water bottle, you know, half a pound would be perfect. But really what I want to do is start to activate these muscles, begin to strengthen them and apply a little bit of load to them without aggravating them. If I'm getting aggravation by just moving through an up and down motion here, I can just sit there, take it to there, and just kind of do an isometric hold for about 10 seconds where I'm just holding, and there is a little bit of tone there, and then I'll relax it down. Don't want to apply a lot of stretch. That's one thing that's commonly done with irritated tendons, and whenever you apply more load to them, they can become more irritated. So then from there, if I'm able to do that, I can start to do some cross friction massage. So I'm just taking the pads of my fingers here along there, not too much pressure. Think if you were making a hamburger, not so much that you want to push through the burger when you're kind of putting together, just to kind of shape the burger, that amount of pressure. If you tolerate that well, you've tried it a few times, you can actually go through a little bit more pressure, and this is a cross friction massage, so I'm trying to increase blood flow to the area. I can do it with the hand nice and relaxed on the table, or a little bit of pre-stretch on the muscle just to hit different areas. Find where it's a little bit more sore and just kind of hit that. I can also do some circular massage patterns, finding where I'm most sore. If I tolerate that well, I can actually go into a little more advanced massage where I can do some functional massage, something we've covered previously. So I'm actually using gravity to lengthen the muscle. So that was for that brachioradialis, that one that flexes the elbow. This will actually be for the forearm extensors. And I'm just using my finger pads here. I can use a bit more of the actual tip if I can tolerate it. First, I just want to start more diffuse, 3-4 fingers, move down to 2. And I'm just kind of hitting it and going in different directions, different angles. From there, I can do a different type of massage. I actually got 2 10-pound plates here and my roller, and I can just kind of roll over it. This is a nice passive way to do it. So if that tendon's getting aggravated with a little activity, or maybe I'm really, really sore, and I'm not crushing my arm. You know, if I was crushing it, I'd be lifting up those plates there. I'm just doing a nice little roll, not over any bones, and I'm just rolling it. And that actually feels really, really good. This is a really easy way to massage it. And then from there, I got some other stuff I can do. So if you have something like this, I know a lot of people are buying these things. You got to make sure you're doing it the right way. But to start, if you have some sort of Graston tool or some sort of instrument-assisted soft tissue mobilization tool, you'll see potentially on that video that one side is a little bit more diffuse than the other, meaning it's more rounded and comes to less of a focal point or sharp point. And I'll start with that, so I'll just get a little bit of this stuff. This is actually homemade stuff, so shout out. That's my cousin's old company there. And I'll just throw this stuff on there. Might have got a little bit much. You just need something to give yourself a little lubricant between the skin, and I'm just kind of spreading it out right now. And there's a couple techniques that I like to use with these where I'm kind of keeping this end of it kind of still, and I'm doing these little half circles. And I can do it once again with my hand resting or hanging off. And I'm pulling towards me, and then I'm coming back. I'm not pushing down and back, so I'm pulling towards, going over the skin back, pulling towards, over the skin back. And then I can actually, if I tolerate that well, I can go the other way with that other side, but realize I may irritate the skin a little bit more, cause a little that petechiae where there's a little almost like bruising on the skin. But I'm not coming off the skin ever, so I'm keeping contact with the skin. And this can kind of help alleviate if you have any tacking down of the skin or the soft tissues, the subcutaneous, that fat tissue right under the skin. If it's tacked down to the muscle at all, and then you can kind of mobilize it away, kind of finding where you're most tight. You're not hammering it here. I'm just kind of strumming across. I'm going longitudinally, but I can also come against that, horizontal to the arm. And I can use different parts of the tool, and I can actually kind of hold it like a pencil, kind of get in there between a couple of the muscles and just kind of follow them up. So there's different things that I can actually do with this. Grab a rag here. And it's something that's very, very effective a lot of times when dealing with some sort of lateral epicondylitis, lateral epicondylosis, that tennis elbow syndrome. So from there, another thing that we like to do is ultrasound. You know, this is just one that you can buy online. You got to be careful when you buy any tool online, and you want to make sure that it's third-party validated. Some of these things can get way too hot, way too quick, so you want to make sure that you're actually using one that does what it says it's going to do, and that you understand what it's going to do. So that ultrasound is going to use a waveform to mechanically heat the tissues through a little bit of vibration. So I can use that ultrasound on here as well. You know, and there's a lot of debate about ultrasound and its effectiveness. I found it's very effective for some people, and you know, others maybe not as much. For this, we would do a thermal ultrasound. So that would be a continuous waveform. And if you don't know what I mean, if you look into ultrasound at all, you'll see that some of them have a pulsed, where they're pulsing, and some of them actually have a continuous waveform, and that continuous waveform is going to actually be a thermal ultrasound. And you could spend 6, 7, 8 minutes on here. Another way to actually heat those tissues a little bit. Heat pack is good as well. And you're not staying in one spot too long. Small little circular motions, kind of hitting the area. If you don't know about ultrasound or how you should be using it, you need to do your research first. Kind of finding where it's most sore, and I never hold it in one spot. I'm always moving it. If I feel that feeling where it's like, ooh, that's getting a little warm there, or I feel a little discomfort, I need to increase the size of area that I'm actually doing the ultrasound over. For sake of time, I'm not going to do a full time on here, but you can find some decent home ultrasound units similar to this one for probably around $100 online. So that's another option, but you know, that's just it's just an augmentation to proper movement, rest, and some other things. The other thing we can do to increase blood flow, if you've watched any of our videos before, blood flow restriction, because what that's going to do is that's going to limit a little bit of the ability of the blood to actually travel distally, because what it's going to do is it's going to press down a little bit on the artery. You got to make sure you don't have any precautions. These are the Air Bands cuffs. We actually did a video on these before. They connect to your device here, and you want to make sure you have no contraindications or anything like that. So this will actually do a good job. Get back here. Okay, this will actually do a good job of going through some of the screening stuff, as you can see here. And I don't have any of these, so I'm just going through it. Now from here, I'm going to actually find my, I'm going to let it calibrate. I'm going to find my occlusion pressure, just let it go. Arm should be about heart height. And you can hear it working here. Something I want to let you guys know about, certification in speed and agility. So this is actually through the National Sport Performance Association. So shout out for the shirt. Great course that they have on their website there. So great little gig they got going on. If you work with a lot of speed athletes or anything like that, check them out. National Sports Performance Association Certified Speed and Agility Coach, the CSAC. So this thing's calibrating, and what the BFR can do for you. So 143 millimeters of mercury. Proceed. I'm going to do 50% occlusion, and I can do my activity here. Inflate. I can do my activities with this on. I can do whatever. Basically, it's going to close down some of that arterial flow, but it's also going to limit more so the venous return, which is beneficial in that it's going to keep blood in this area, which is what we kind of want. So the blood is going to kind of push into all those little deep crevices and all those deep little capillaries, those tiny little vessels. So you could sit here with this on. You could do some passive range of motion. You could even do some massage with the BFR on. You could go through some activity with it on, doing some actual exercise, kind of how we talked about in the beginning. And I can do massage, or I could just do my nice little lowers. Either way, I'm training this and I'm allowing blood to get into that area. I'll just leave this on for a second. The other thing we got going, and we just did a video on this as well, is the cot massage gun. It doesn't matter what massage gun you have. This one's just convenient. I got it here with me. And just a little massage in that area. This is pretty nice because it kind of, that percussion allows perfusion of all the blood, and it kind of pumps the blood in the area, as well as the other fluids that are in that interstitial space, the space between all of the cells and everything like that. So just coming through, nice relaxing massage. Another thing that's very, very beneficial, staying off all the bony prominences. And so now we've gone through a bunch of different things. The other thing you can utilize that we didn't really talk about in this video is some electrical stimulation. Talked about heat packs. So there's a lot of stuff that you can actually do if you have lateral epicondylitis, lateral epicondylosis, or even that tenosynovitis. And what you're doing is you're trying to load that tissue, pain-free range, and then ultimately increase the blood flow to the area. And by doing that, you can give it the best chance to heal and for some of that collagen fiber realignment, and ultimately decrease the pain so you can get back to a lot of your activities that you're doing. Like I said, majority of you are going to have that tendinosis, that tendinopathy, so the way in which you deal with it is a little bit different. NSAIDs and things like that aren't going to be the best, because while they may decrease your pain, there's actually no inflammation in a tendinosis case. So, a little education on that. Hope you guys are able to try this. If you don't have an ultrasound or a BFR cuff, no problem. The most important things are resting it from the activity that's bothering it, starting to gradually load it and apply a graded load over a period of time. And if you're doing an exercise, you want to stay in a pain-free range. Initially endurance is better, but you don't want to go into too many repetitions. You don't want to do it too often. Massage gun, things like that, you can do fairly often, but you want to stay away from loading this thing too much, too often, too soon. So rest, light activity, get that thing moving, get some blood flow in the area through whatever modalities that you like to use. We really like that massage with the roller, something that you should be able to easily do at home. That functional massage, cross friction, give those a try. Let me know in the comments section how it goes. We've talked about before loading things with isometrics. We've done a triceps tendonitis exercise video. If you guys want to see a bunch of different exercises that you can try and then alter, if you have a lateral elbow issue or forearm muscular issue here on the lateral side, let me know in the comment section, because I'll put a whole dedicated video just for exercises on that. Otherwise, I hope you guys have enjoyed the video. Give some of this stuff a try. Experiment a little bit with it, and don't be too aggressive. It takes time to heal. It's going to take probably about 3 times the length of whatever time you think it's going to take. If you think it's going to take 3 months, it might take you 9. And we know if you have a tendinopathy, tendinosis, those things take a considerable amount of time. They don't resolve in a week. If you have a tendonitis, there's a chance if you do the right things, it can resolve really, really quickly. And same thing with a tenosynovitis, as long as you don't continue to exacerbate it and aggravate it. So if you like this video, give it a thumbs up, subscribe to the channel. We're going to do another video, like I said, on medial epicondylitis, medial epicondylosis, different techniques we'd use, because there's some things that we wouldn't do on the inside of the elbow that we would do out here, and vice versa. So stay tuned for that video if you've had any soreness, discomfort on this side of the elbow, and we will see you at that video.